Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et le Premier ministre, l'honorable Blaine Higgs. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Bon après-midi à vous tous. Good afternoon, everyone. For the fourth consecutive day and the sixth day of the last 7, there are no new cases of COVID-19 reported in New Brunswick. We have had 118 confirmed cases since the outbreak began, of which 14 remain active. And while we continue to have patients in hospital, no one has been admitted to a New Brunswick hospital with COVID-19 since April 12th. Pour la 4e journée de suite et la 6e fois au cours de 7 derniers jours, il n'y a aucun nouveau cas de COVID-19 à signaler au Nouveau-Brunswick aujourd'hui. Il y a eu 118 cas confirmés dans la province depuis le début de l'éclosion et 14 d'entre eux demeurent actifs. Bien que certains patients soient toujours hospitalisés, personne n'a été admis à l'hôpital du Nouveau-Brunswick pour une infection à la COVID-19 depuis le 12 avril. We have been successful in this early stage. Many of the dire consequences that other jurisdictions are experiencing have not come to pass in New Brunswick. But this does not mean that we are in the clear. Our hospitals have not been overwhelmed by a flood of COVID-19 cases, but they may yet be. Our nursing homes and special care homes have not been decimated by the spread of the virus among workers and residents, but we still have to be vigilant and very cautious. Our doctors and nurses have not been forced to choose which patient will get a respirator and that will save their life. And I hope that doesn't happen, but it could. Nos hôpitaux n'ont pas été submergés par une vague de cas de COVID-19, mais cette situation pourrait toujours se produire. Nos foyers de soins et nos foyers de soins spéciaux n'ont pas été ravagés par la propagation de ce virus en sein des employés et des résidents. Mais cette situation pourrait toujours se produire. Nos médecins et nos infirmières n'ont pas eu à décider lesquels des patients auront droit au respirateur qui leur sauvera la vie. Mais cette situation pourrait toujours se produire. Je n'espère que ça n'arrive pas non plus les situations avec des foyers de soins. On travaille vraiment fort maintenant pour éviter des problèmes comme ça et des situations comme ça, mais ça peut encore arriver. Our success to date has given us time to prepare for the next wave when it comes. By staying home, practicing social physical distancing, and maintaining proper hand hygiene, you have given us a chance to get ready for what comes next. And again, I can't state enough how much effort and how much work so many people have done and what sacrifices people have made for the success that we've achieved thus far. But this is not the end. And even with the successes that we've seen, obviously, there have been hardships as well. So again, I want to thank everybody who has been doing everything they possibly can to contain this virus. En restant à la maison, en respectant les consignes de distanciation physique et en exerçant une bonne hygiène de main, vous nous avez permis de nous préparer à ce qui s'en vient, parce que la guerre n'est pas finie. Alors, tout ce qu'on a fait d'ici, tout le monde qui ont fait leur part pour arriver ici à ce point maintenant, c'est vraiment, vraiment important et je vous remercie pour tous les sacrifices que vous avez faits pour que nous arriverons à ce point. But that's why I continue to ask that you observe the restrictions set under the provincial state of emergency. And that's why I ask that you continue to take precautions against the spread of the virus, even when those restrictions have been eased. When you stay home, in your own home, as much as you can, you are saving lives. When you maintain 2 meters of physical distance between yourself and others, you are saving lives. Lorsque vous restez chez vous autant que possible, dans votre propre maison, vous sauvez des vies. Lorsque vous maintenez à au moins 2 mètres de distance des autres, vous sauvez des vies. Even the simple act of washing your hands regularly and thoroughly is a life-saving gesture, and I can't express that enough. Again, the importance of all of these measures as we move into a new phase, these measures will still continue to be extremely important. Alors, quand on commence à traverser à un autre point de l'éclosion, toutes les mesures qu'on a mises en place, puis toutes les choses que vous avez faites, rester à la maison, laver les mains et rester à distance de 2 mètres entre personnes, ces choses-ci vont encore être de plus en plus importantes quand on fait des changements à la commerce, etc. Ces choses-ci vont être encore plus importantes. Alors, j'espère que vous les observez continuellement. We all have things to do. We all have to do these things for some time until a vaccine or some other treatment is widely available. So this is our new normal in terms of these particular actions that will protect us. It's my hope that having seen how this has enabled us so far to fare so well at this point, that you will carry on these practices in the weeks and months ahead. They are absolutely necessary for our success collectively. Many of our traditions will have to change, at least for the time being, and this will be hard for many of you. But I believe that New Brunswickers will see the benefit of these actions. I truly, truly believe that. So in this light, I would like to wish a sincere Ramadan Mubarak to all Muslims in New Brunswick as they prepare for the holy month of Ramadan, which begins tomorrow at sunset. In the Islamic tradition, the breaking of the daily Ramadan fast is marked with a communal meal known as iftar, which is shared among family and friends and others who practice the faith. But this year, I'm asking you to have these gatherings with only members of your immediate household. And I understand that there are Muslim communities across Canada that are organizing virtual iftars where people can meet online to remotely break their daily fast. So I encourage followers of Islam in New Brunswick to join these activities so that you can safely practice the tenets of your faith. I would also note that today is Earth Day. And this is an occasion to remind ourselves that this is the only habitable world we have, and we must take good care of it. The COVID-19 crisis has demonstrated the fragility of life on Earth and how all that life is connected by an intricate web. And I'm reminded by the words of the renowned Canadian environmentalist David Suzuki. A staff person actually reminded me of these words, and she passed them along to me. And she said, David Suzuki said, change is never easy, and it often creates discord. But when people come together for the good of humanity and the earth, we can accomplish great things. So we can't take our world for granted. Every day we get to spend here is a blessing and an opportunity. Let's resolve to not waste it. Nous ne pouvons pas nous permettre de tenir notre monde pour acquis. Chaque jour que nous passons sur la Terre constitue une bénédiction pleine de possibilités. Assurons-nous de ne pas gaspiller cette bénédiction. Thank you very much. Merci beaucoup.
Good afternoon. Bonjour. During this pandemic, we've all gained a great appreciation of the importance of staying connected with the people we love. We found new ways to stay in touch with the friends and family members who we can no longer visit in person. Dans la dernière semaine, la technologie a joué un rôle plus important que jamais pour nous aider à rester en contact avec les autres. Durant cette période difficile, il est très important de rester en contact avec les aînés qui font partie de nos vies. Visitors have not been allowed in our nursing homes, and I know this has been very difficult for residents and for family members who they're used to visiting on a regular basis. We want to ensure these connections are not lost. That's why we are providing New Brunswick nursing homes with iPads to help residents stay in touch with their family and friends. The Department of Social Development will provide 1 tablet per 10 residents. In total, the province's nursing homes will receive about 480 iPads. We are working with BrenNet to deliver the tablets and provide technical support. Even after the pandemic is over, these devices will be a useful tool to help residents stay connected with their loved ones. We are also working with the Department of Health to install a virtual care application in each iPad to allow doctors to provide care to residents remotely. Cette application de soins virtuels va permettre aux résidents d'avoir accès à leurs rendez-vous médicaux réguliers et de respecter les mesures de distanciation physique pendant la pandémie. Elle va également nous permettre de fournir des soins de différentes manières à l'avenir. J'ai hâte de pouvoir explorer de nouvelles façons d'utiliser ces tablettes pour améliorer la vie des résidents de foyers de soins. This is just one way we're using technology to our advantage during the COVID-19 pandemic. Early on, we established a phone line that New Brunswickers could call if they had concerns or were looking for more information. Since it was set up, we have received more than 8,000 calls. Cette ligne téléphonique est une excellente ressource, car elle nous permet de mieux informer les résidents à mesure que la situation évolue. Selon la nature de l'appel, nous orientons les gens vers des ressources comme les navigateurs d'affaires au travail sécuritaire Nouveau-Brunswick. Any information we have received about noncompliance with the emergency order has been referred to law enforcement for further review. Most people have been complying with the emergency order, and law enforcement officials have been focused on education. It is a very small number of cases that enforcement has actually been required. As of Monday, a total of 29 tickets were issued for violating the state of emergency order. Je suis fier de constater que le nombre de personnes qui respectent la loi dans les provinces est aussi élevé. Grâce à votre collaboration, je pense que nous pouvons réduire certaines restrictions de l'ordonnance d'urgence très bientôt. This is something I will be discussing with the All-Party Cabinet Committee on COVID-19 during our meeting tonight. Over the last few weeks, we have all been focused on responding to the challenges of COVID-19. This has been a task like no other, and our healthcare providers have played a key role in our success thus far. I want to reassure New Brunswickers that I haven't forgotten about the commitment I made in February to meet with the communities where the regional health authorities had proposed changes to the healthcare system. I look forward to visiting those communities in person when it is safe to do so. The input of community leaders in enhancing our healthcare system is vital, and I plan to work closely with mayors and other representatives from these regions. For now, I want to ask everyone to continue to keep up the good work. As Dr. Russell told us, once again, we have no new cases of COVID-19 today. That is good news. New Brunswick is on the right track. Continue to follow the directions of public health. I hope to be able to bring more good news in the days ahead. Thank you. Merci.
Monsieur Premier Ministre. Thank you, Premier. Merci, Dr. Russell. Thank you, Dr. Russell. Okay. We will now proceed with questions from the media. Each reporter will have one question, and you have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste aura une question et vous avez le droit de poser vos questions dans la langue de votre choix. Andrew Waugh, Telegraph-Journal. Your question, please.
Thank you. My question is to the Premier. Premier, regarding the 480 iPads, you said one iPad per 10 residents. A, is that a safe thing to do, to be handing iPads between residents? And B, why was the number 480 picked? Was it a supply issue, a cost issue, or is there a possibility you could have gotten an iPad for every resident?
Well, I think that, as I understand, certainly it was a choice that Horizon Vitality looked at in terms of what to get, how many per residence. I understand there's other nursing homes in other provinces that may have done something similar. Basically, it's believed that there will be someone there to assist the the resident to use the iPad. It is something that it will be cleaned regularly. If it goes from one, it'll have to be cleaned regularly if it goes from one resident to another. But it's my belief that that's what they felt they could administer, and having that everyone have an iPad would not necessarily be effective because many would not be using it on a regular basis or familiar with the technology to use it.
Thank you. David Caron, l'Acadie Nouvelle.
Oui, bonjour. Oui, m'entendez-vous?
Toujours.
Oui, Donc, ma question s'adresse au premier ministre Blaine Higgs. Je vais parler pour que la traductrice puisse me suivre. Donc, hier, vous vous êtes prononcé en faveur du report des pêches printanières au 15 mai. Aujourd'hui, Pêche et Océan a annoncé que la pêche au homard a été reportée au 15 mai, mais que celle au crabe des neiges doit commencer ce vendredi, donc le 24 avril. Donc, est-ce que vous pouvez juste préciser votre position? Donc, est-ce que votre demande de reporter la saison s'applique aussi à la pêche au crabe des neiges qui va commencer vendredi? Et si oui, est-ce que le gouvernement compte agir d'une façon quelconque?
Certainly, our request around May 15th for the lobster was based on the request from the MFU and the processors that they could not manage the catch. They weren't in a position to start up the processing plants, and therefore they were all working together to delay the season. In the case of the snow crab, any activity, if there is a market, and it's my understanding there potentially is a market and they're able to sell, but they still have to follow the rules and guidelines around managing that. So we'll be working with the actual fishers and understanding, to what extent can we follow and be able to manage the healthcare requirements as part of the fishing. So one was certainly not because of necessarily being able to follow or not follow the health rules. It was based on the ability to sell and process the lobsters.
Thank you, Premier. Merci, M. Caron. Savannah Awad, Telegraph Journal.
Hi there. My question is for the Premier. Dr. Russell had mentioned that COVID-19 measures will be lifted and reintroduced on shorter notice as we need. But some in the business community have said this pattern is unsustainable as there are longer-term and sometimes costly decisions to be made, such as hiring and investing in the costs of reopening, such as installing plexiglass so that the stores are safe. What would you say, I guess, to businesses looking for greater guidance as they weigh these long-term decisions with a very fluid situation?
I guess I'd reinforce that very last statement. It is a fluid situation, and we'll continue to work closely with Dr. Russell and her team in relation to what is the appropriate measures to take to start up a business. And I think every business has to weigh, are they able to make those appropriate measures sustainable? And, our overall focus is to keep our curve obviously flat as it is today and manage that as we start up. And any changes to that, and I think as we start up and open up our economy and our society more so, it's all in keeping with the standards of following public health guidelines. And we'll be tracking it along the way because we know that we're apt to see changes in our caseload when that happens. But what would be, when a business is looking to start up, they need to look first and foremost, are they able to follow the rules put in place? Because those rules will not change. Those rules will be there. And if they're able to continue to verify that they are following the rules and no one is being exposed because of that, then I would guess that there would be a reasonable certainty that they'd be able to run and continue to operate. But it'll, we're on new ground here as we start to rebuild our province and our economy.
Thank you. Matthew Wacomo, l'Acadie Nouvelle.
Bonjour, ma question est pour M. Higgs. Une question sans lien direct avec la COVID-19, mais ça vient juste de tomber juste avant la conférence de presse. Le président, directeur général du réseau de santé et vitalité, Gilles Lantaigne, a annoncé il y a quelques minutes qu'il allait prendre sa retraite dans 6 mois. Je me demandais, M. Higgs, si vous pouviez commenter la nouvelle et nous dire si ça avait un quelconque lien avec la réforme des urgences et si M. Lantaigne aurait pu rester plus longtemps s'il l'avait voulu en poste.
It's news to me as well. I did learn of it, I believe, yesterday. I got to know Mr. Lantaigne a little bit over the last year, and certainly recognize the dedication he had to the Vitality health system and to our health system as a whole. I commended him in the past about the ability, you know, working together with Horizon and Vitality as they were building strength within our system. And so I was surprised to learn of his plan to retire, but I would not believe it's connected in any way to the Emergency Measures Act or if there's issues that they're not known to me.
Merci, Mathieu. Silas Brown, Global.
Hi, Premier. You mentioned the consultation sessions that were scheduled for the spring on health reform. I'm curious what this experience through the pandemic, if anything, has taught you and the province and the health department about the needs of the healthcare system and what sort of things might be useful for it moving forward.
You know, I think going forward we'll be able to make a long list. But if I was just to note a few, it would be how well our health authority across the province have been working together on a very focused issue, and that was the pandemic. How to you know, treat it in unison in relation to how we learn from each case and how cases were responding, and how we work together for priorities. I think we've certainly moved forward in areas of e-health and innovation. We see the virtual appointments for doctors now that you know, wasn't there before. We saw you know, movement of ALC patients that you know, had been in a hospital scenario situation, but not in a surrounding that was best suited for their needs. And I think at this stage it's 170, maybe 180. The patients were moved to the right facility in a nursing home to give the right level of care that's needed. So we saw that happen quickly when it wasn't, you know, it was taking a long time before. So we've developed a task force that's working very, very closely together with you know, our health authorities in all sections, with Dr. Russell's team. And I guess for me, it's like we can't lose that spirit of cooperation, our spirit of setting goals and targets and getting them done, and every one of us taking responsibility to make it happen. That's why, you know, learning from this, and as I mentioned about going to visit our communities, which I intended to do in this time period earlier, it's like, let's not lose the momentum of just how good we can be. Let's be part of a continued success story. So let's hope we continue to maintain our levels, you know, very, very low or to non-existent, and in the COVID crisis. Let's hope we can continue that, but let's continue to rebuild a healthcare system in a way that it can be responsive to our citizens, so we no longer are waiting months and years for elective surgeries, for seeing doctors. We can be much better. This pandemic has proven that.
Thank you, Premier. Thank you. Vicky Hogarth, Charlotte County TV.
Thanks, Bruce. My question is for the Premier. Premier Higgs, many communities are still unable to find hand sanitizer in stock. Do you know when New Brunswickers can expect to see a steady supply in the province and on all store shelves?
We have, I can't speak to the store shelves as such, and because you know, we don't manage their inventory, but certainly we do have access for adequate supplies for our use in terms of the hospitals and our health networks, and for any activity associated with government operations. So I would guess that we could work with individuals in the particular retail network, and basically ensure that we're sharing information as regard to resource supply and hand sanitizers. We know there's 2 or 3 companies that are making it here in New Brunswick. So certainly we can be helpful there. There's lots of contact numbers for us to get in touch with these folks and or them to get in touch with us. So we would certainly do that and share whatever information we can to help.
Thank you. Laura Brown, CTV.
Hi, Premier. I'm wondering if when you begin to look at relaxing some restrictions, specifically on businesses, are you still going to be asking that companies who can work from home or can have their staff work from home continue to do so? And are you going to consult with businesses as you begin to relax restrictions on them?
So certainly the choice of whether a business would want their employees to continue to work from home will be theirs. If they feel that, you know, they can bring in, let's say, limited number of employees, and that way they can meet the social distancing requirement and the directives of public health, then that'll be their choice. So each one may be different, and that's not something that we'll prescribe. Our actual requirements are going to be to allow businesses to start up while at the same time meeting the directives of public health. So the two go hand in hand, and businesses can choose how they best can meet that. But not meeting it will not be, you know, an option. We want to make sure that we do not, you know, we know opening up is going to increase risk, but we need to minimize those risks in many ways because we're balancing starting up and with our economy and people back to a normal way of life as much as possible, albeit recognizing that normal is very different today than it would have been last year at this time.
Thank you, Premier. Thank you, Ms. Brown. Michel Corriveau, Radio-Canada.
Oui, merci, Bruce. C'est une question pour Dr. Russell. Dr. Russell, le Premier ministre tantôt faisait référence à la réunion multipartite de ce soir où il sera question d'une réduction des restrictions qui seront discutées. Alors, j'aimerais savoir, selon vous, Dr. Russell, quelles seraient les restrictions qui pourraient être levées? Qu'est-ce que vous recommanderiez, en particulier là, pour les individus, pour les gens?
Alors, d'après la santé publique, les recommandations pour les choses qui pourraient être ouvertes, c'est des choses qu'on a prises de l'Agence de santé publique du Canada dans nos discussions, dans nos réunions chaque semaine. Et alors, ça, c'est des avis qu'on donne au gouvernement, puis le gouvernement va prendre les recommandations, puis c'est eux qui vont faire la décision avec les discussions ce soir et aussi demain. Alors, je peux donner des exemples. C'est dans les mêmes veines que le premier ministre a indiqué que si c'est la partie de la commerce qui peut ouvrir et en même temps continuer à observer les règles sur la distanciation, les choses comme ça. Alors, si c'est quelque chose que le commerce peut faire, c'est ça, les directives vont être dirigées sur ces directives-là.
Merci. Gail Harding, CBC.
This question is for Dr. Russell. Going back to the comments you made yesterday about the need for testing to be done at a certain level to maintain the accuracy of the data, how do we manage to maintain that level of testing if we continue to have no new cases and presumably fewer people with no symptoms?
Yeah, we can adjust as time goes on, so that is part of the plan moving forward. So to watch those numbers and make decisions around changing and expanding the criteria to allow it to be fewer criteria than there are right now, and then also moving into testing people who are actually asymptomatic, who don't actually have symptoms. So that's a progressive approach, and we will keep monitoring the numbers to make those decisions as things evolve.
Thank you. Adam Harris, Telegraph Journal.
Thanks, Bruce. A question for the Premier. The federal government and the provinces were in talks last week on a wage top-up for frontline health workers and also a rent subsidy for businesses still paying out commercial rent. I wanted to know why there wasn't an agreement as of yet, and if New Brunswick could potentially not be a part of these programs.
We are actually putting together our list, you know, of essential workers that would qualify under the federal program. I will be having a national call with my colleagues tomorrow in relation to how that works, so you know, to see that we have, you know, somewhat uniformity across the country. But so we are doing that in order to allow application. And then there's question about how is it administered? Is it administered through the federal government? Is it administered through the provincial government? How's it handled? So we're trying to get the details of all that, plus share our list of workers who qualify under their current program. In relation to the rental or the rates, we have a program in place for businesses. We had our own program there, and so it could be used for various reasons. But we are seeing that the private sector particularly are moving in that sense, allowing some some space there because they want their tenants to certainly come back. And so they're not moving people out. They're basically, for the businesses, they're deferring and working a plan to have them stay there. And our program that we have is an overarching one that they, and the federal one as well combined, that can be used however they see fit. So I think we have to be careful of because what we're seeing is a lot of overlap in some ways, and we have to find a way back through all of this so that at the end of the day, we have an economy that starts up and is sustainable for itself, and we'll be able to meet the many challenges we're going to have in the coming months, and not just try to, there's more programs coming out every day from the federal government that we're trying to understand the details, and that's always not readily available.
Thank you, Premier. Thank you, Mr. Harris. Tom Bateman, Times and Transcript.
Good afternoon. I've got a question about screening protocol in airports. Following news of the New Brunswicker who tested positive for COVID-19 while working in Alberta, are people entering the province via an airport, either through charter or passenger aircraft, screened in the same fashion as those who enter New Brunswick on a highway? And if the answer is yes, I just wonder how many are still entering the province that way. Thank you.
Thanks, Tom. So basically, the airlines are regulated federally, but the federal transport minister, Marc Garneau, did actually issue an interim order to prevent certain persons from boarding flights in Canada due to COVID-19, and the details of that are on the website, and they were issued on April 17th. So as of right now, there's a list of things. They have to meet screening requirements. I believe they have to wear a mask. So there is a list of things that they have to do. So that is in that document that's online.
Thank you, Tom. Colin McPhail, CBC.
Thank you. This is for the Premier. With the talk of easing restrictions, we're getting a lot of questions from New Brunswickers who are keen to see their families and loved ones they haven't seen in weeks. And I'm wondering, how does the recovery plan as it stands address this issue?
So that has been our focus over these last several days in relation to developing a recovery strategy in many sectors, and doing it in waves, so to speak, so that we can ensure that through it all, we're able to monitor the impact of changes and how we allow more movement and more access. So in fact, we're reviewing, a portion of that tonight with our COVID Cabinet Committee and discussing the ideas and getting their input. I'm reviewing tomorrow with Cabinet with the goal that, the numbers have been very encouraging. We're working very closely with public health to ensure that whatever we do it in a methodical way that people can continue to respect the rules, and we do it so we won't have to go back. We want to move forward and not be moving back and forth, but it obviously depends on the success of a continued low count in the tests, even though we anticipate there would be some change. I'm encouraged by what's happened in the last 2 weeks. We said that we wanted to have 2 weeks after the Easter weekend and have, to see where our testing would go over that period of time. And I got to say, I'm very encouraged by what has happened and this low count, which is a good indication that we should be seriously considering movement in several fronts, but to what degree is to be determined. And we are having those discussions today and tonight and tomorrow because we think the time has come to do something, and we want to recognize the diligence that citizens have had, and I'm very encouraged by the possibility.
Thank you, Premier. Thank you, Mr. McPhail. Barbara Simpson, Telegraph Journal. Barbara? John Chillibeck, Daily Gleaner.
Hi, my question is for the Premier. Pharmacists who've been working extra hours helping the public on the front line during this pandemic are upset about your statement last week that they should be considering waiving dispensing fees and co-payments on drugs.
They say they have no control over this national drug shortage that forced them to start dispensing every 30 days instead of every 60 or 90 days. They also say they have to pay their staff doing extra work for more frequent drug dispensation. So I just wanted to know, what would you say to them, given that they're upset? And if you could let us know about negotiations between the College of Pharmacists and the province over this issue.
So certainly, I certainly agree that the pharmacists and the employees that work there have been working very hard to fulfill the requirements of and healthcare needs of residents, and no one's going to dispute that fact in any way, shape, or form. The situation was not waiving the co-pays and it was waiving the additional co-pays and dispensing fees that citizens are incurring. Now, this was an order that the College of the Brunswick College of Pharmacy put in place, and I guess with every need for change, it was based on the concern that we could have a drug shortage, and I'm not suggesting that's not a valid concern, but I think it's important to recognize which drugs are would be in a shortage of supply, and is there a difference? Obviously, there is between some drugs and another. Does that supply shortage still exist, and what are the concerns? Because let's base it on the reality of the situation we're in, and I'm the first one to say let's look at the facts, let's understand the needs. Does it apply to all drugs? Does it apply to some of the more critical ones or higher usage of drugs? And let's understand what the supply shortage really is. That's where I would go with any argument is let's put the facts on the table and go from there. I think that there have been a lot of discussions recently with the Department of Health, with the Minister of Health, and the Pharmacy Association to work through this. The ultimate goal is to ensure that we charge our citizens, and I'm sure it's the ultimate goal of the many pharmacies and their owners across this province, to have a fair price for the services being offered, and that's our goal in any of this. So let's put the facts on the table and make the appropriate decision guided by the facts.
Thank you. Barbara Simpson, are you on? Voilà la fin de notre mise au jour aujourd'hui. Merci beaucoup tout le monde. That concludes today's update. Thank you very much.